Welcome to the Child, Family, and Community Wellbeing Learning Series. As Jessica pointed out, this is our final forum of a 2-year journey that we have been on together to learn together. Before we get started, I would like to make, as is our custom, our land and labor acknowledgement. In order to address centuries of the collective harm and trauma to African American, Indigenous people, and other groups, we must make an intentional choice to rebuild American communities in an equitable manner. Each of the learning forums has started with an acknowledgement of our collective history as a step towards reconciliation and a constant reminder of our intentions, purpose, and goals for coming together. We acknowledge and pay our respects to many ancestors for their enslaved forced labor that they endured for this country's development and economic progress, from which we all draw privilege. We highly encourage everyone to do their own research on these aspects of our history, and we have some resources for you in the chat to do so. Before I get started, I want to personally acknowledge living and working on the traditional, ancestral, and unceded territory of the Chumash, Gabrielino Tongva, and Fernandeño Tatavian peoples, who are the rightful caretakers of the land we now call the San Fernando Valley. This learning series has been formed out of some shared intentions. And given this is our last learning forum, I'd like to just spend some more time here than we normally do to check for fulfillment of those intentions. So one of our primary intentions was to create an opportunity for counties and tribes to learn from subject matter experts and engage one another about how to create a prevention infrastructure, a comprehensive prevention infrastructure. One that has shared accountability and responsibility among cross-sector partners, and one that shares authentically about the challenges and complexities of implementing and operationalizing comprehensive prevention plans. The speaker page on the Caltrin website, I was looking at that this morning. It lists these experts, and I was really taken aback by the level of expertise that we have been able to bring to you over these last 2 years. I want to thank all of our faculty deeply, both for their work in the field and for their expert presentations. This learning series has created a durable library of this expert content that has been skillfully curated for you by Caltrin. And this resource has been and hopefully will continue to be a practical and useful resource for you as counties, as part of county and tribal teams building and implementing their comprehensive prevention plans. We also wanted to strengthen cross-sector relationships by learning together. County child welfare, juvenile justice probation, behavioral health, education sector, community-based service providers, child abuse prevention councils, tribal partners, and parents and youth with lived expertise. If you look at our registration sheet, we have many of those folks present here learning together with us today. We still have some ways to go with regard to getting community-based providers and parents and youth with lived expertise at the table. And you know, John Pedigo and Ron Brown showed us ways that engage authentically with communities. So we have a poll in that vein to see today who's here with us. Haley, if you could launch the poll for us, and we'll just get an idea of actually who is here learning together today. We have our child abuse prevention councils are here. I see CBOs. Got consultants here so they can take back what they were what they've learned from these forums, so the teams they're supporting. Well represented county child welfare and probation. All right, let me give it a few more. minutes, and I'm going to end the poll, show you. Yeah. So in the vein of strengthening cross-sector relationships, we do have a representation across broad sectors today. Thank you all for joining, and please take these conversations back into your interagency leadership teams, your implementation team meetings, your governance structures, and continue to learn together. All right. Stop sharing those. Okay. So strengthen cross-sector relationships was one of the intentions, to position counties and tribes to better examine and build their capacity and ability to effectively partner and engage with parents and youth with lived expertise. Like I mentioned earlier, we have one learning forum specifically that really we learned from working with the Latinx population in Santa Clara County. We learned from the Magnolia Community Initiative about what authentic engagement looks like. And then we wanted to support you in measuring and decreasing racial disproportionality. We heard from our partners at Chapin Hall about the importance of disaggregating data and equity-focused continuous quality improvement. And lastly, we wanted to anchor ourselves this year in primary prevention and extend downstream from there. And another way to say that is that usually we start at the door of our systems, which is considered tertiary prevention. And often we lose steam by the time we move ourselves upstream to secondary and primary prevention. Primary prevention in particular is where equity lives. And we deliberately started our learning series earlier this year there, and then started to move towards secondary prevention and building community pathways for folks that now are at risk of family violence and child maltreatment. So that brings us to the present day. Today, we're going to talk about our comprehensive prevention plan journey together. We're going to celebrate accomplishments and look forward to the work ahead. To help us do that, I've got two colleagues here with me that I deeply respect. Cheryl Treadwell is the branch chief of the Safety Prevention and Early Intervention branch at CDSS. Cheryl's been in this business for 24 years at DSS in the Children, Family, and Services Division, and has worked on several programs and initiatives that impact providers, resource families, foster youth, and tribe. And most recently, we know Cheryl and her branch is leading the implementation efforts on Part 1 of FFPSA, the Family First Prevention Services Act. As chief of the branch, she ensures that she ensures oversights of programs and policies focused on the front end of the child welfare system. And her educational background spans both social work and the legal field, along with extensive experience working in the community human services sector for the last 30 years. Stephanie Inyama is a team member of mine from Implematics. She is a seasoned organizational community consultant with extensive experience in both corporate and social sectors. Over the past 3 decades, she has been instrumental in enhancing various human services programs, particularly focusing on child welfare and homeless delivery systems. She has expertise in project management, program development, community engagement, and advocacy that she has skillfully applied to benefit numerous organizations, communities, and government entities throughout California. All right, so without further ado, I'm going to stop talking and I'm going to turn it over to Cheryl Treadwell.
Thank you, Kush. I would have to say I have to appreciate the support and the collaboration that we've had with Implematics, Casey Family Programs, Caltrend, and the great presenters, the faculty, as Kush has referenced, that have participated in this learning series. And I have to say also to thank you out there for showing up, because without you, there would not be much meaning to the work that we do and why we do what we do. So we are here to support you, and I appreciate the fact that these learning series have had great response. So I would like to first do that shout out, and let's move on to the next slide. So as Kush has mentioned, we've been on a journey, and I want to just highlight here sort of what that journey has looked like. We first started, of course, with the federal authority and the law back in 2018. And of course, as we move through this timeline here, as we always do in California, implemented a state law to conform with planning around Families First Prevention Services Act, which is riddled with a lot of features beside part one, but part one is where we are today. So we have AB 153, which is our state law and our program that we refer to as Families First Services. And I wish we had renamed it now that I think about it, because I know it confused people in the beginning about, is it the federal law or the state law that we're working on? But this is compliant with the state law is compliant with what the federal law is meant to intend to accomplish. And then as we move along, we did a robust engagement process on our prevention plan with the intent to get it together. We engaged with the communities, counties, CAPCs, numerous amounts of folks. After we issued the ACL, explained to the counties how to interpret this law, and then we submitted our plan to ACF, and in March got our approval, and here we are today. So if you look at the journey, as you can see, it's taken 3-4 years to get where we are. And just an indication that this process takes time. So let's go to the next slide. I wanted to highlight the work and some of the work products and efforts that we have produced over the last few years. We created a community engagement toolkit that came out of the OCAP Bureau. Kush mentioned the Reimagining Prevention series webinars that focus on racial equity. Hayward Burns and Junius Williams, I think those were great presentations, and I think they're worthy of folks to revisit. If you need to do that, I would recommend that you revisit those webinars. We've had a really successful statewide convening that was led by our strategies folks and a team of other consultants. We had up to 700 participants, which to me indicated the need to recognize the support for prevention planning efforts. The cross-sector planning teams were there. That was a huge success. We are tailoring our support for small county needs now, recognizing that small counties need something very different than what larger urban middle-sized counties have in terms of resources and options about how and the ways that they will implement FFPS. So we are working to identify solutions to some of those barriers that were shared with us in that small county teamwork group. We've been working diligently on a training, the foundational training and curriculum development around prevention, working with our Northern Regional Training Academy on the training for trainers. A lot of that is out. The first series of that has been conducted, and that is in the midst of working. The state is responsible for the oversight of model fidelity. And we are pleased that we are now contracted with Chapin Hall. I'm sorry, not Chapin Hall, but we are contracting for a panel of experts to put together the components of what that model fidelity oversight might entail. Our CQI process is the one that has been contracted with Chapin Hall. And we are starting to frame out how we will build a CQI system to look at how prevention is working in California. We continue to consult and engage our tribes. We have 2 4E tribes that have submitted prevention plans, our Karuk and Yurok tribes. So we're excited about working with them and the counties that are associated with those tribes with their implementation around prevention activities. And then, of course, the successful series of the Learning Series Partnership. So this is just a highlight of some of the accomplishments of supports and efforts that we've achieved over the last few years. Next slide, please. So I'm going to highlight through my presentation what we've gleaned so far from the prevention plans. Of course, most of the lead agencies are primarily the child welfare, probation, and 4E tribes, of course. We had 50 counties opt in, and 2 tribes, as I said, you had to opt in via a letter of intent for part 1. To date, 46 plans were submitted. We've approved 37. I believe recently there's a couple more to add to those numbers, and we have a few counties that are in the process of still developing their plans and have extensions out. We noticed that 27 counties are choosing to implement the community pathways, and that's exciting. And then we have 7 counties that are intending to be a part of this mandated reporter to community supporter approach that is being led by the Child Welfare Council. So next slide, please. So in the comprehensive prevention plans, we noticed that a majority of the plans are leveraging their 2083 interagency leadership teams. And that is something that we are excited to see, because we definitely want you to take advantage of existing structures and not reinvent something that you don't need to do, where you have that evidence, have that opportunity in your counties. Some counties already have prevention cabinets in place, and they elected to expand that and use their internal prevention cabinets to be their governing body. But there's been cross-sector planning across the gamut of child welfare, probation, all of the teams and folks that are responsible for serving our communities and families across the state and in your county. And all of the plans, we had required that they indicate to us how they're engaging with their tribes and how they're engaging with folks with lived experience and parents in the youth. This may seem to be typical work, but I would like to expand and say we have to repeat this, because I think sometimes people forget that on this journey we need others, and the folks that we serve, we need to make sure that they are at the table and have that voice. Next slide, please.
And Cheryl, before you move forward, we have someone with a hand up.
Okay.
I just wanted to see if make sure our tech is working and folks can. Okay, the hand has gone down. All right, go ahead, Cheryl.
All right, thanks for recognizing that. So on this slide, we're talking about the selection of the EBPs, the evidence-based practice models. Most commonly selected, as you can see here, was motivational interviewing as a cross-cutting approach, and we're excited about that. And noted in here with the P's is that probation has also selected this. So that is what the P means, is indicated on this slide. Parents as Teachers and Healthy Families of America are the top 3 that came through in the plans. Listed below are the other EBPs that were selected. You can see PCIT, FFT, MI as an EBP for the substance abuse approach. 1 or 2 counties on the eye movement desensitization and reprocessing. That was interesting. And young kids, incredible years. And of course, we're looking at high fidelity wraparound, where California has been in the front of leading that effort for a number of years. So we're happy to see that identified in plans. Next slide, please. Within each of the plans, there are also listed primary and secondary prevention strategies. And listed on this slide are the examples of some of those primary and secondary prevention strategies that we expect to see implemented. We have a guaranteed income pilot program that is being led by our sister division in our family and engagement division. Um, we see counties implementing, they're establishing advisory committees. As I said, elevating the voices of lived experience. We're seeing programs in counties where they want to increase employment readiness and support programs, um, looking at funding volunteer programs from the community, and looking at more crisis intervention services for youth. And when you think about these strategies, they speak to, you often hear us reference the social determinants of health, where what people need to live and have a quality of life, to be healthy, to have wellness, to have the education aspects of their communities lifted up. Some of these opportunities are in the prevention plan, and I like the fact that counties are making those connections. When you think about prevention and where we're trying to cast that net earlier upstream, some of these are indications that counties are recognizing the need to do that. Next slide, please. And then the state made an investment of $200 million for what we are calling our state block grant. And as of June, we've had small expenditure of that, and rightfully so, because of the fact we recognize a couple of things. Counties are reserving the funds for future federal match when we are able to draw down 4E, or they are reserving the funds for the implementation of direct services, which is being delayed as a result of our automation timeframes, which is further out. As we know, sometimes sequencing of automation and sequencing of delivery of services don't always line up ideally for us, and that is the case for this. And then the fact that counties also want to first leverage those one-time funding sources, which are time limited and they need to expand. They are spending those funding sources first. We're currently exploring, looking at the option, and we know that everyone is concerned about the extension of the block grant. I think there's advocacy and support out for that, and we'll know soon what the results of that will be, because a lot of that is left up to our legislature. But I also would like to commend counties for being thoughtful and planning around how they propose to spend this money if they're not spending it now. So the minimal indication to me doesn't concern me, but at least concerns are generated around what support you need so that you could do and spend this time to plan thoughtfully about how you want to leverage these dollars. Next slide, please. This slide indicates there were other funding sources and what those funding sources were. And that was the encouragement that we, you have money, and then you've learned from these previous learning series. If you listen to folks like Alice Briscoe and other folks from Chapin Hall about how to leverage your dollars. Don Wynn said about 4 ways to think about your entitlement funding. Counties listed under other funding sources, such as that are not here, like realignment money, even money from the Department of Cannabis Services. So there's streams of funding out there that were present in a lot of the plans that were submitted. Okay, next slide, please. And here are some of the other activities. This sort of just lays out the activities that were identified in the CPP plans. These were the approved activities that were outlined for what the block grant requirements indicated. So they're using funds. You can use the funds for delivering EBPs, concrete supports, and all the things that we listed above. This is the same in this slide here, so I won't repeat those. So let's go to the next slide.
Yeah, and Cheryl, we do have a question that I think is sort of relevant here.
Okay.
There's a question about compensation for community engagement and participation.
Mhm.
Um, and the question about how to account for expending funds to support that the engagement of folks with lived expertise to compensate them for their time to be at tables. Anything to say about that while we're talking about funding?
Well, I would say track it, of course. There's no prohibition against it. I think that is what we are encouraging. That is an appropriate expenditure, and if we've indicated otherwise, then let me know that. But I think that's been our message. Um, and if you need other expertise, if there's a particular concern about how it's tracked, then you need to let us know what that is. But I would just say, it's a line item in your budget that indicates what that expenditure was for. Stipends, how I don't know how folks are characterizing it, but it's an appropriate expenditure. So I would just encourage you to continue to track that, and there's no prohibition of using that funding that way for state block grant money. Um,
Yeah.
I don't know that provides clarification other than the fact that it's permissive, and we just expect you to keep track of those dollars.
And then, Cyril, you alluded to this, but there's the matter of future expense. The funds do technically expire in June of 2024. Just connecting that to what you said about the extension, and that it sounds like CDSS is advocating for an extension, but ultimately it is up to the legislature whether those funds get extended. Anything else to say about that or timelines?
No, other than the advocacy is there, and it's an inside outside approach. I mean, there's other ways to message that need besides CDSS leading that charge. But I think I would encourage you, as in the previous presentation, also that there are other funding sources to spend as well, and think about how to leverage even block grant money. And I'll talk about this later in the presentation too. There are other opportunities to spend block grant money now that will jumpstart your work in prevention. So, but we do the best we can with what we have, right? And I think the counties should be strategic about that. And to the extent that you have consultants and experts that could help your thinking with that, I encourage you to continue to work with those experts.
Thank you, Cheryl.
Just to say a little bit about this slide, is just it references the federal requirements that we have to prepare our workforce, and meaning our county staff, providers, folks that will be involved in this implementation must be qualified to provide the services that are consistent with the well-supported practice models that have been selected in your county. The state we're providing training in the areas around how we're going to monitor safety and risks, how to conduct the risk assessments, family engagement, knowing how to access and deliver the trauma-informed evidence-based services. Just evaluating all of those areas are the requirements that we are working on right now, and we have the responsibility for monitoring. Go to the next slide, please. We have, as I mentioned earlier, we are working with our training community, getting those in place so that they can deliver that first tier 1 round of foundational training, which basically includes the overview of what FFPSA is about, how you shift the mindset towards prevention, addresses that implicit and bias and disproportionality. That first round of T4T training, I believe, has been delivered. There's more to be delivered and to be determined later on those dates in terms of integration of ICPM, which is Integrated Core Practice Model, that we are implementing at the state and county level. And the motivational interviewing piece, we are starting discussions around how we might support statewide implementation and what aspects of that we can support the scaling up of MI, since we have so many counties interested in the cross-cutting approach for using motivational interviewing. Okay, next slide, please. I had mentioned about the contract with Chapin Hall to set up CQI. You know, and I don't have a slide in here about our governance structure, but our governance structure includes all the state agencies. We're putting in place our Families First Advisory Committee. It'll be some ad hoc committees that will be append to that, and then these will be the feedback loops that also attach to our CQI system. So the governance structure now, I mean, the FFPSA Advisory Committee, as I said, is being stood up now, but part of statewide CQI would allow them to review our success of the programs, look at data, what our standards are for review, looking at how we're going to measure the outcomes for the program, using that plan, do, study, check, model, act that many of us are familiar with when we're talking about gathering feedback. So that is, I'm excited about working with Chapin Hall on this work. And of course, I spoke earlier about model fidelity. We are still establishing a panel of experts and to figure out how we at the state will monitor how model fidelity is happening and being implemented in county land. Given that we have so many, that's a daunting task. And so we feel like we need experts to inform that decision and discussion for us. Next slide, please. So I borrowed this slide from other learning series presenters, and this is just a slide to sort of display the opportunities and flagging the opportunities between the intersection between Medi-Cal and Medicaid and child welfare intersection when I talked about the social determinants of health. And we are entering a time and opportunity, I think, more than ever in the state of California to really look at how Medicaid, or what we call our Medi-Cal program, can be used to address prevention strategies if these factors are addressed in families, in their communities. So, you know, looking at the areas that are identified on here around where people live, their neighborhoods, quality of care, you know, it's centered person. And I think this is a tremendous season to be in California, to really work with our partners in the behavioral health system to bring some of these supports to our prevention work. Next slide, please. And so this is another slide that I shamelessly stole from one of our presenters, sort of depict some of the opportunities around EBPs. Here are 3 EBPs that were identified in what they are calling the BH Connect program, which stands for Behavioral Health Community-Based Organized Networks of Equitable Care and Treatment. That's a loaded word. Those are loaded concepts right there in the effort. But if you're a county and these are 3 of your EBPs that you're implementing, why not have that discussion with your behavioral health folks in the county about how to stand these up with your child welfare community? So, and what comes with this is resources. And so this is just an example of making those connections and having those conversations about possibilities to start your prevention work while you're waiting on pulling down the other federal resource of 4E. But there's a lot of leverage here too, through these other initiatives that are unfolding.
Cheryl, there's a while we're on EBPs, there's a question that we have that has come up perennially on this learning series about, so that there is a requirement for folks to have an EBP in their comprehensive prevention plans. Yet there are so many existing prevention-oriented traditional practices that counties or communities are using that don't meet EBP requirements. So anything for you to say about how folks, you know, strategically reconcile or their, you know, kind of that tension where they do need an EBP, and EBPs are more traditionally, FFPSA funded and the tertiary prevention part of things. But then there are these traditional other practices that may not be EBPs. How could they do both?
Well, I would say that you can do both by looking at using some of those other funding sources to roll out those other services. And I know if this is specific to small counties, that is some of the discussion that we're having to sort of tailor, what can we tailor for small counties that don't have EBPs in their counties, but you have other services that you might want to lift up, as Kush said. So we're going to get in the trenches with you to sort of figure that out. And if there are ways to implement those services with the block grant funding, I know that there's some nuances to that. But there might be other ways to look at that with other funding sources too as well. So what might that be? And that is what might need to call out what's available in other systems to do the work. And we know small counties are unique. So that's why we really want to have more further discussions so that we can tailor our strategies to meet that need.
And you did mention high fidelity wraparound, Cheryl. That is something that has to be part of your Part 4 program. It is an EBP, and I know that there's some it's on a slide, and there's some consideration of having that possibly be part of the slate of EBPs that a small county might lift up in their CPP.
Yeah, thanks for bringing that back to my remembrance. That is exactly one of the examples of a way that we can scale some services in the smaller counties because of the presence of that program in our state and in small counties. So that is one strategy that we're looking at.
Great. Appreciate that. Thank you, Cheryl. All right, here we go.
Okay, so this slide is just another opportunity to talk about what's out there in the community. It's not easy to see, but it basically shows you that there are that child welfare foster kids have been identified in the Medicaid world around this care management, and there's services associated with that. Then you look at the bottom, what talks about community supports, and it lists the percentages of managed care plans that are addressing the social determinants of health. And so I think that's important when we think about the larger scale of comprehensive prevention planning, what's out there in the community, and to have our Medicaid and behavioral health system now becoming part of building that network. It's great opportunity and timing, I think, for child welfare to be in that space in a really unique role to partner. Next slide. Okay. So this slide has all the links to the resources, to the plans. You want to see the approved plans for the counties. They're posted on the Caltrans site, and the other resources here, and also the link to the Behavioral Connect and all the learning series. So if you have not taken advantage, please take advantage of these resources. All right, so I thank you for the time with me, and now I'll turn it back over to Kush.
Thank you, Cheryl, and then we may have you back later on when we do an open Q&A section. All right, so we've been doing a learning series for the past 2 years. And each learning series, whether you've been aware of it or not, has spoken to what we at Implematics know to be the implementation domains that one always has to look to if you want to implement something comprehensively. The governance, how are you going to govern it? What's the oversight going to look like? How are you going to engage stakeholders? What's the actual design of the program? What policies are going to be needed to make sure that the program has procedures and protocols and rules around which folks can function. How's workforce development going to go with regard to this new programming we're going to have to launch? How are you going to monitor service quality and outcomes? What are your fiscal resources like, and how are you going to strategically string those together? How is all this going to be automated? In what databases is all the service data going to sit, or the funding data going to sit? And then ultimately to the funders and the regulators, how do we report on what we're doing? And all of this has to happen in the context of equity and inclusion. So, for example, do we have equity and inclusion with regard to our tables where governance is happening? Are we engaging all the stakeholders, or just the ones that we find easy or convenient to engage? Does our program design actually target bringing equity and restoring health to communities that have been traditionally underserved, et cetera, et cetera? So these domains, these planning and implementation domains, have undergirded the curricula for both 2022 and 2023. In 2022, we started off actually with fiscal, which, by our diagram is a little bit later on, because we know there was a lot of anxiety about how are we going to do comprehensive prevention in a way that we've never done before, and how are we going to resource it, and how are we going to understand what our cross-sector partners funding streams are? What can you do with FFPSA money? What can't you do? And so we launched 2022 with a special emphasis on fiscal and funding. And then we went on to tackle some of these other domains: prevention system governance collaboration, how to design a comprehensive county prevention system. Like how could we draw a picture of one? What's its design? How an initial discussion about how we're going to how one might tackle service quality and model fidelity to achieve outcomes. And then we had a session on preparing the workforce to deliver FFPS, or Family First Prevention Services, which is our state interpretation of the federal law. And between each learning forum, we had a Q&A session, which brought the faculty back as a panel of experts, and we had Q&A sessions. So folks could directly engage with the experts in small groups and get some of their more local questions asked. And then in 2023, we, as I'd mentioned earlier in my introduction, we made a deliberate decision to start all the way upstream, where the social determinants of health live, where basic quality of life for communities live, so that folks aren't put at risk of the toxic stress that then leads to family violence. And we started even in front of primary prevention. We started at what I term primordial prevention, which is attacking the social conditions that caused communities to become unhealthy in the first place, the structural inequities that led to those communities being underserved and left to fend for themselves without resources. So we started with equity as a context and attacking disproportionately unhealthy communities head on. We moved to primary prevention planning. So how do you start doing planning around getting the social determinants of health, services and supports around the social determinants of health stood up? What conversations even do you have across your sectors about primary prevention planning? And then once you've had some of those planning discussions, what does it look like? How do you stand primary prevention up inside of these domains? Then we move to, so primary prevention allows you to restore health to communities. right? But there will still be families that are going to require supports and services. Right? And could we design community pathways for those families that had as less as possible contact with formal crisis-oriented systems to get services? Right? That's what we mean by a community pathway to services. And so we spent two learning forums on what building a community pathway for families might look like. Who would you have to have at the table? How would you have to engage CBOs differently? How could you prevent families who already mistrust systems? How could you have them have as less contact with formal systems as possible so they could really get their services and supports from trusted providers that have been working in their communities for years? How do you support those providers that don't necessarily have the traditional infrastructure but are doing really good work in their communities? And then we moved to secondary prevention. Secondary prevention prevents family violence from happening in communities and families where the risk factors are high, where they've been put at risk. And so we talked about how might we fund primary and secondary prevention? How might we fund services and supports around social determinants of health? How might we fund services that enhance protective factors in communities and families? And then we have arrived here today, which is our final learning forum with our CPP journey. And we're hopefully you've gotten a view, a bird's eye view of some of the work that has happened. And in a moment, I'll talk about what's there to do now. Where should we start to move our sights to now? And again, these implementation domains can serve as a checklist for you as you move forward with your implementation. If you keep looking to these, how are we doing with regard to governance? How's our workforce development coming? How are we connecting to some of the workforce opportunities at the state? How are we connecting to some of the CQI work that's happening with the advisory committee? These will serve you as you move forward. So the learning series have fulfilled their intention of having us sit together and learn from experts. That we have had some time for peer exchange, right? But what we heard when we started to think about, well, what does 2024 look like? Should we have a learning series, or do we need to pivot to something different? And where, after speaking to stakeholders, after considering things like more learning forums or learning collaboratives, we really saw the need to move from learning together, which we've done now over the past couple of years, to actually really doubling down on peer exchange. That's what we've been hearing from stakeholders in county and tribal comprehensive prevention planning teams. We want to learn from each other. Hey, I'm doing a guaranteed basic income program. Is anybody else doing one? How are they paying folks with lived expertise? I'd love to know what other counties are doing. Those are the kinds of things we were hearing. And so I'm about to turn it over to my colleague Stephanie Nyama to talk to you about our solution to what our stakeholders were saying they needed in order to move forward in this journey. Stephanie, please go ahead.
Thank you. Next slide, please. So when we talk about the next chapter, right, we looked at this and said, well, how do we share the information about the next chapter? So we have 3 stages, right? The first stage is, how do we rethink how we collaborate? If we're talking to folks and people are saying they want to do peer exchange, they want to learn from each other in other counties, so how do we rethink how we collaborate? And then the second stage is, what could it possibly look like, right? And then when we created it, the new platform, it's a matter of what have we done and what have we learned? Next slide, please. So with the stage one, it's really relooking the status quo for new opportunities. Next slide, please. So our challenge statement. How did we come up with this challenge statement? Basically, what Kush was saying before is we were hearing that people wanted to do the peer exchange. They wanted to share information. They wanted to discuss and discover new innovative ideas to bring to the prevention work that they were doing. Next slide. So what we did is we did our research. Within the learnings, we researched and we incorporated best practices for online communities, best practices for communities of practice. We incorporated the human-centered design approach, and we also looked at what are some of the best online community platforms. We also did our interviews. We talked to individuals who are boots on the ground in prevention, doing the work. What would it look like for you to work differently and collaborate differently in an online community of practice? We talked to one person who said she actually took her 15 hours just to connect with somebody in a different county. We were like, okay, we know it won't take 15 hours on this new platform we were trying to design. Then with feedback groups, we created 2 feedback groups. We had an advisory group, which was full of senior county leaders who are working on prevention. We asked them for directional and conceptual ideas associated with the online community of practice of building it. We also had a statewide user group that we worked with. These are, again, individuals who are boots on the ground doing the work, and we would talk to them and they would give us insights and recommendations on how to build, what it would look like for an online community of practice. Sorry. Next slide, I'm sorry. So then from the challenge statement, from the community input, and from the research, we came up with our vision statement. We realized it had to be, what we were going to design had to be user-friendly. It was going to be online. It had to be able to engage California counties and tribes who are working in the field of prevention. And we wanted to make sure that it had the goal of equity and the elimination of disproportionality. There were resources accessible for underrepresented and marginalized communities, and it improved safety and well-being for all children and families. Next slide. So trying new ideas. Okay, so we've done our research. We have our challenge statement we've used. We have our vision. So now it's trying something new. So it's kind of like letting go of the old ways and embracing and creating something new. Next slide, please. So what is CalPrevents? It's an online community of practice. If you're currently working in support of California FFPS and the broader prevention, CalPrevents is for you. You can become a member of CalPrevents. Whether you are a consultant who lives in a different state and you're working in support of FFPS for California or broader prevention programs, you can become a member of CalPrevents. It's for anyone who's working in support of California Family First Prevention Services in California, and you can become a member of CalPrevents. Next slide, please. All right. So we started to look at what are the milestones that we've done. So we have our vision. Now we know what CalPrevents is. So as we were doing the work, these are the milestones that we were able to accomplish. So we had a limited launch in August of this year. We've done over 25 presentations to different groups, different counties, different organizations. We currently have, as of last week, we had 93 current members. I think we're up to a little bit over 100 now. we've been building networks of professional organizations looking to partner with others who can not only just become members of CalPrevents, but also those who are engaged in CalPrevents, right? We're finding champions to support CalPrevents. When we say champions, those who see it as a benefit, who use it to support their work, and who also advocate and share information to others about, hey, CalPrevents, maybe this is a platform that we can use. One thing that I want to say is CalPrevents is a support to the work that you're already doing. It's not in addition to, it's not something, oh, let me go over here and let me stop what I'm doing to go and see what this CalPrevents is about. CalPrevents is really about the work that you're doing using it on a different platform so it's easier for you. And then we're also looking at defining ways to engage child and family wellness professionals. Next slide, please. So what can members do on CalPrevents? Right now, members can use the member directory to contact their peers. As I said, someone earlier said when we were interviewing, it took her 15 hours. CalPrevents, you can go to the members page and say, I want to contact somebody in Sacramento or somebody who's on CalPrevents in Riverside. Who is that person? Or maybe there's someone who's posted something in the communication hub, and they're working on the same thing you're working on, EBPs, and you want to talk to them and see what they're doing. It's easily accessible for you to meet with new members or existing members in the directory. Next. You can send private messages to other members in the directory. Next. You can ask questions and get answers relevant to what you're working on. Next. You can share research papers, conference materials, and documents. Next. Access resources in the Resource Hub. The Resource Hub is the one thing that we wanted to make sure that it's organized, it's easy to use. We're not, with the Resource Hub, we were very intentional about not reinventing the wheel, right? There's a lot of resources out there. There are a lot of ways to access information. We were looking to really make the Resource Hub a way for information that's kind of hard to access, information that is not really, that people may not really know a lot about, that's on the Resource Hub. But also there's just some resources that people need now that they may not be able to have access to, or it may be in another place. We can simply add a link. Like, for instance, we have for the CPP, the approved CPP plans. We don't have all of that information in CalPrevents, which we'll show you shortly. We have the link to Caltrin because it's housed at Caltrin. So we're just making sure that we have the resources so that people will say, I'm looking for this resource. Let me go to CalPrevents. Maybe CalPrevents will have that information, or I can share this information and we can post it in CalPrevents. Next, please. And then you can do online courses and meetings and events as well on CalPrevents. Next. And then you can set up special spaces, which we'll talk about when we're getting ready to do the tour, where you can have unique groups based on topics, geography, by county, or by tribe. And we're launching spaces this month in November. We've just launched it. Next slide, please. Okay, now it is time for our tour. And I will share my screen. Okay. It's loading. Okay. So this is CalPrevents, and we are on Statewide Connect. CalPrevents Statewide Connect is the Office of Child Abuse and Prevention and KC Family Programs has brought you this for child, family, and community well-being. Statewide Connect is the space on CalPrevents designed to bring together individuals and teams working on prevention efforts throughout California's tribes and counties. So what are the things that you can do on Statewide Connect? You can connect with people who are working in California on prevention strategies. You can engage in dialogue, and you can share and discover. So how can I invite my colleagues to join CalPrevents, right? So Spacewide Connect is a space on CalPrevents designed for folks across California working in prevention. We just expanded who can be a member on Statewide Connect. So we first started out, it was just child welfare and probation staff who were working on FFPS. Now we've expanded it, so if you're a tribal member or representative, CWDA, CPOC, if you're a community-based organization, if you work with CAPC, FRCs, the RTAs, if you're a technical assistance partner, basically anyone who is working on FFPS in the state of California can become a member of CalPrevents. You would simply, and I'll show you the form later on, you would simply submit a request to join CalPrevents form. You complete the form, and then we will go ahead and send you an invitation so that you can become a member. And then we talk about once you become a member, what you can do. Once you become a member, there's a checklist that you go through so that you can go through and you can introduce yourself, you can edit your profile. I'll show you some little tricks about editing your profile. And you can also have personal links. So if you have a LinkedIn page or you have your county's website, you can also go ahead and add that to your page. So now we have the conversation board. And when we talk about the conversation board, that's anything that you want to post or talk about when it comes to prevention or FFPS, the work that you're doing. And as you can see, we have lots of folks posting. We have Andrea posted, talking about youth engagement, Juliet. So there's lots of people posting. And one of the things that we've learned, and we'll talk about more, is that we can have an online community of practice and you can become a member. But what makes it great is the engagement and the conversations that we're having, making sure that you know, what we heard was we want to be able to talk to our peers. Well, you can talk to your peers. A community is only as strong and robust as its members. So as you see, we have lots of folks posting. And then we have the resource hub, which we talked about the resource hub before, right? So one of the things you can do on the resource hub is, how do you contact CDSS, right? Right now, how you contact CDSS is the same way that you're contacting them now, through their inbox, their FFPS inbox. We also have in our resources our community agreement, right? So when you come in, you're able to look at what is the community agreement for CalPrevents. Where we also have some helpful links. With the helpful links, we have links to CDSS, we have links to the Caltrend, to the Community Opportunity Map. If there are any other links, as members, if there's other links that you'd like to share or you'd want us to post, you can send it to us and we can go ahead and add it to this page. And we also have CDSS updates where we talked about the CPP plan and the block grant, where we have the allowable activities. When things come up new from them, we also do that. And then if you're looking for the CPP, like I said, we're not looking to reinvent the wheel. We're just going ahead and we put the link from Caltrend to where the approved comprehensive prevention plans are. Then we said, well, what if I'm looking for a member? What if I'm looking for a member? So say, for instance, you said, well, you know, I'm looking for somebody in Sacramento. Who was a member in, Sacramento? It'd be great to type it correctly. Who was a member in Sacramento? Hold on one second. Hold on one second. Who is a member in Sacramento or anywhere? Who are members, current members right now? We have Lydia, we have Dana, we have different members. But if you're looking for a particular member, it's not working right now. If you're looking for a particular member, then you can also do a search for that. Our newest thing that we have are hashtags. I'm sorry, my computer. There we go. So the newest thing that we have are hashtags. So one of the things we wanted to do is, if you're, say, for instance, you're talking about something, community engagement, you're looking for community engagement or community pathway. You can click on community, what's been spoken about in community pathway on CalPrevents. So any discussions that are had about community pathways, you're able to identify it So we're looking that when people are posting their comments, that they will put a hashtag so it's just easier to find what you're looking for. So then when you talk about CalPrevents, think about CalPrevents as the house, right? That's the house, right? Statewide Connect, we call it a space, could also be considered like it's one of the rooms in the house. So if you are, say, Alameda County, and Alameda County says, you know, we want to do a small county group. You know, we have a collaborative. We want to do a small county group. We want to do it on CalPrevents. Well, our team, the community team, we can help you build this space. Here where you see home, conversation board, resource hub, members, hashtag topics, you can customize your space to say anything up here and what you want to be in those topics, what you want to discuss. Also, you can have your space where it's secret, where it's invite only. Right now, Statewide Connect is secret, so it's only by invitation only. You can also have it private, whereas if I'm not a member, I'm a member of Statewide Connect, and I see that Alameda County has another space, and I'd like to be a part of that, then I can request to that space, hey, can I be a member? And they can allow you to be a member. Or you can just have a space that's public that anybody can go to and look at anytime. So we talked about the conversation board as any conversations that you're having in this space. When you go to your feed, if you are a member of 3 spaces, any information or any conversations that you've had in your conversation hub in any of your spaces will be located in the feed. Righty? Then I will go ahead now and show you how to build your profile. So when you first come on, there'll be a checklist and it'll tell you to first build your profile. So one of the things that you can do, which I think is a great tool that the platform has, is so you say, okay, so I have this mini bio. I really don't know, you know, there's so much about me. I really don't know what I really want to share. So if you click Get Me Started, it says, what motivated you to join the community? I can say, I want to learn more about FFPS and want to meet new peers, right? And then you say, well, what's something you can offer others in the community? I can offer expertise and partnership. And then what's something unique about yourself? For me, I play pickleball. Yeah, that's the newest one, right? Pickleball. So I play pickleball. So then you hit suggest, and what happens? It's working on it now. What it does is it creates your information in your about me. And what you can do is you can say, okay, I kind of like this, I kind of like that. I want to change it. So you have the ability to edit it, change it, add more things. And so your about me is already created. And this is where you can go ahead and add your personal links. You can add where you're located, your time zone, all of that. And then you can go ahead and save it. Hard time. There we go. Save it. I'm sorry, having a hard time with my computer today. So then you can also go ahead to your personal settings and say you become a member of CalPrevents and you can have the option. It's all automatically set on daily digest, right? Which means once a day, towards the end of the day, anything that happened in CalPrevents, you will get an automatic notification of it. Or maybe there's a hot topic going on, right? And you say, I want to know the activity as it happens. And then you can also say what you want to be notified on. If you'd like to be notified on if someone cheers you or there's a comment, maybe you're talking about a community pathway, you can also set your notifications so that you can be notified on certain types of postings that are happening within CalPrevents. Okay. And Doc, I will go ahead and stop sharing and bring it back to you.
Thank you, Stephanie.
Next slide. So the new platform. So we've seen what it looks like. We've gone through and we've seen what it can do, right? So now we're saying, what is it that we've learned and what is it that we know? What we've learned is that an online community of practice is as robust as its members' engagement. Next slide, please. So what's needed to build a robust community? We know that we've got to make sure that for all of our members to stay engaged, we've got to help support the creative strategies that will encourage the peer-to-peer discussions. We need to make sure that we have topics and content that are relevant to the work that you're doing, right? So that it compels you to want to participate and maybe even open a space on a specific topic. We want to make sure that we have a resource hub to provide you with access to common and unique resources. And we want to encourage membership so that there's active engagement, right? So that, you know, if you're a small county or if you're a county or even a new staff person working in prevention and you feel like you need support, you can come on to CalPrevents and you can ask your questions, or you can meet someone. You can chat with someone. You can send them a chat. Hey, you know, I'm new to this. Can you, spend some time, or can you talk to me? I need some understanding. So it allows you a way to engage with members all at once or with individuals, either on the statewide Connect space or to create your space. So it allows a lot of different opportunities for you while you're doing your work in prevention, doing your prevention work. CalPrevents is a great support to the work that you're doing, to access to peers and access to resources. Next slide, please. So how members can help. So currently we have existing members that we're looking for you to be champions. It's great that you can say, I'm on CalPrevents, I'm new. I see that they've been doing some communications. I see that, we can create a group, maybe this is something we can use, or I'm on CalPrevents, and it is a great way for me. It has helped to streamline the work that we're doing. It's been very helpful. It's convenient. CalPrevents never closes. 24/7, you will always have access. The only hours that are limiting, I guess, are the hours that you're sleeping, but the CalPrevents is always open for you. Next, please. And then participate, right? So we said there's one thing to become a member, it's another thing to actually participate on the platform. It was built for all of you who said that you wanted to have this peer interaction, for all of you who are looking to find new information, to discuss innovative ideas and to share. So the more that you participate, the more that you can use CalPrevents, the better it will make for you, the better it'll help you, and it'll help others as well. It can really help streamline a lot of the things that you're looking to do to implement your work. And lastly, provide feedback. Let us know what's working and what's not working. Make recommendations on, what about doing this? Or what about a hashtag for this? Or what about a resource for that? What about, can we add this? Can we do that? We are constantly getting feedback from everyone. One of the things that we've been very intentional when we opened and started developing CalPrevents, we were very intentional about making sure that we're listening to all of you. When you all say that this is what you want, this is what we need. We didn't build CalPrevents for us. So it can't be, well, this is what we think you need. This is what we think you should do. We started by saying we know we needed to create a structure, a platform for all of you to be able to do the work. But how we built it, how it's been built now, how we've created it, has been all from input from the prevention community, right? From the directors to the line staff. We've talked to some of the tribes. We've talked to a lot of different individuals, and we're constantly getting feedback now. So any new ideas or feedback that you submit, please be rest assured that we're not like, oh, okay, yeah, we'll get to that. No, we're taking it all in, because the purpose of CalPrevents is to build it for all of you. So when you all tell us it should be this or it should be that, we're going to go ahead and we're going to look to see how we can incorporate it in the best ways. Like we saw before, we had a soft launch in August. We've made a lot of adjustments since then, since our soft launch, just from feedback, from sharing and doing tours of CalPrevents from other folks, with other folks. We've done some adjustments. We are constantly trying to improve it and make CalPrevents better for all of you, so that it's something that is a go-to for you that supports the work that you're doing. Next. Request to join. So some of you last week and some of you this morning may have received an email saying, hey, why don't you fill out this request to join CalPrevents form so that you can become a member? Well, this list is the list that we've taken for everyone that's ever attended any of the learning forums this year. You would have received an email from us saying, hey, why don't you join? So as of this month, November, anyone that received it, anyone that's a CBO, anyone who is a tribal member, anyone who is a partner in behavioral health, working with child welfare, probation, you can all become a member. And I'll go ahead and share my screen. So just to show you what the form looks like. 1 second. Okay, go back here. Go here. So when you complete the form, it'll look like this. It's a long form we don't have to go through. And then once you complete the form, then we will go ahead and send you an email that looks like this. And all you simply have to do is click the Get Started button, and it takes you directly into CalPrevents. And I also want to say that you can also use CalPrevents on your tablet, on your phone. There's a way that you can download the app to your phone, so you can take CalPrevents on the go with you anytime. Thank you. Kush?
And Stephanie, they can, that QR code there will take them straight to that form that you showed?
If you use your phone right now and use that QR code, it'll take you straight to the form.
Great.
Thank you.
Okay. So CalPrevents, fully supported and endorsed by Casey Family Programs, the Safety, Permanency, and Early Intervention Branch, the Office of Child Abuse Prevention, is ready and waiting for your collaboration and feedback. So what might be some of the things you want to start talking about on CalPrevents? What topics now might you want to start to point your planning teams toward in 2024? Well, first, you want to plan the kinds of conversations that you have at your planning tables, at your oversight tables, when you're developing a plan, are very different than the conversations you're now going to have to implement that plan. Each strategy in your comprehensive prevention plan, be it guaranteed basic income initiative, be it mandated reporting to community supporting, be it we want to stand up motivational interviewing as a cross-cutting case management intervention, each of those in essence become mini implementations. Okay, and your governing body has to shift from thinking about planning and developing something, a document to send to a regulator, to how are we going to oversee all those implementations, and how are we going to monitor how they're all going as a family of interventions, all pointed at certain outcomes that we want to see for our county, be that reduction in the use of foster care, be that increase in the social determinants of health in our targeted communities. Okay, so shifting the conversation from planning to implementation. Okay, It's the same domains, though. Right? How are we going to govern implementation versus plan writing? Which stakeholders do we now need to have at the table? Do we need to add folks? Do certain folks drop off now that we're out of the planning phase and into implementation? How do we pay for folks to be at these tables? To point to one of the questions that was asked earlier. Program design. Okay, so you had a nice logic model that was a picture that you sent in your plan. That logic model has to get refined and turned into things you can contract around. So the activities that were 4 or 5 bullets in a column on a logic model need to get burst out further and get to drill down further. Where else should you start to look? Building your community pathways. 27 of you elected to have a community pathway, have a way for families to get services and supports with as less contact, especially the low risk families, less contact with child welfare and probation systems as possible. So how do you go about actually building one of these now and installing it so families can use it? So CBOs can engage families to use their services. Well, you're going to have to now double down on what you said about being interested in community engagement and mobilization. You're actually going to have to go find those pastors. You're going to have to find those curanderas. You're going to have to find those natural supports in the communities and start to have conversations about them. Like, well, here's what we put in our plan. Help that bring us to life. What would it need to look like for you to trust it? You're going to Cheryl pointed to this. We do have the block grant, although we are, waiting on what to see if it's going to be extended or not. But there are resources from adjacent systems that folks are writing checks now for things like community workers and doulas. Managed health plans are thinking about transportation and access to services. So how can you start to leverage some of these resources from adjacent systems to get some of these strategies going, even though they may get funded by something else down the road? Provider selection and contracting. Community pathway is going to be only as robust as the trusted providers that families see are in it. And so RFPs, contracts, how do we write performance-based contracts that point to the same outcomes that we've identified as wanting our prevention, our comprehensive prevention plans to serve? And then, this year, we talked a lot about primary prevention, that is preventing communities from becoming unhealthy or restoring health to unhealthy communities. We've also talked a little bit about secondary prevention, which is actually supporting those who have now been put at risk in unhealthy communities to prevent family violence that comes from the toxic stress that families are under. It's now time to start to open the tertiary prevention box. Tertiary prevention is preventing system involvement and further family violence in families that are already exhibiting some signs of it. These are the families that are right at the door of our probation and child welfare systems. So what do we need to add to our primary and secondary prevention systems for these families? Which EBPs, or would the EBPs that we already have for the others suffice? And central to that tertiary prevention planning and implementation conversation is front-end redesign. So counties and tribes, how will you design your front end to be hospitable to divert families away from the door of the system, to actually connect them to that community pathway that you've built? Are you going to have prevention units where everybody's just doing prevention in terms of your workers? Or are you going to have existing workers do both prevention and foster care? How does your screening and intake have to change? How does your hotline change? How does doing emergency response change now that you've got this other system as a resource? We've got a prevention system as a resource to prevent families from entering or getting deeper into systems. So that's really going to be a key topic for folks in 2024. You're going to start to do, now that you've picked EBPs, the work starts on installing them. How are we going to do the training? Which model fidelity tool are we going to use? Are we going to use the online AI-based one, or are we going to use the paper and pencil one? And then are we going to maintain and monitor it ourselves if we're the child welfare probation or tribal system, or are we going to contract that out? Right? These are decisions that you're going to have to start to make. Monitor the CARES build out as it goes. So you can time it. You can time your candidacy determination, your claiming processes to align with when those components come online for CARES. And ultimately, right, the real celebration is going to come. And I can speak for myself, when that first prevention plan is in the system. Right? We are serving families. But we don't need to wait till that first prevention plan's in the system, right? Could we start using some of these other resources? Could we start, once we have a little more reassurance, use the state block grant to start to fund some of these services now? Because this has been the point of all of this, right? Is to actually have moms, dads, siblings, brothers, sisters, families. We have families thrive. Families enjoy a quality of life in this great state of ours. So those are some of the things that in 2024 we should be seeing on CalPrevents. You should be asking your consultants and TA providers about. You should be starting to encourage your governance structure to start to look at. And then to close, right? We always want to go back to why we're doing this, like why there's a need for prevention in the first place, right? We have a history in our country of marginalizing groups, of forgetting what their customized needs might be, for ignoring communities until things get bad enough that we start to see multiple referrals into child welfare and probation systems. And we're accountable for that, not the communities. As I said earlier, primordial prevention, which is even before primary prevention, targets the underlying stage of family violence by targeting the underlying social conditions and structural inequities that promoted its onset in the first place. And what's equity work look like? That, it's the thing that undergird all those implementation domains. Well, it looks like restoring health to communities by investing in them, putting our money where our mouth is. It's going to look like targeted universalism, where we start to look at, well, where are all our referrals coming from? What's life like for folks in those communities? What are we missing with regard to services and supports? And then universally targeting everyone in those communities, not the ones that just we've seen in our hotline calls or our screening calls. It looks like community healing and self-efficacy. And I've watched some child welfare leaders recently do this beautifully. When you engage communities, there's a lot of water under the bridge. There's decades and centuries of trauma to lift up and get beyond. There's a lot of listening. There's a lot of apologizing, even though you weren't there personally 200 years ago. There's a continued reinforcement, and not just verbally, but in actions, of tribal sovereignty. Are we actually treating tribes like sovereign nations and having government-to-government conversations with them? Are we asking our tribes, if you're a county, hey, we like this TA provider, what do you think? Should we contract with this TA provider? And then ultimately, There's been a lot of talk about, at least, in the worlds I live in, where we're educating social work students, a lot of talk of abolition of these systems that you and I have worked in all our lives, right? Well, it isn't about closing those systems down tomorrow. That's not what we're after. Those conversations are after building robust systems of mutual aid in those in those communities, ultimately, so we can render the systems, at least as we know them, obsolete. So we can actually, we say this a lot, work ourselves out of a job. Right? So prevention stands to bring some hope back into child welfare and probation. I've got, to speak personally, a lot of students right now who are wondering about whether they'd like to join into these fields, given all the talk and all the rhetoric, and all the and what the pandemic and the racial reckoning have shown us. Really, having folks work on prevention brings hope back. And I want to close by pointing us to what Edward Jones told us when from ABFE in our first learning forum of this year with our racial equity impact analysis. Right, when we're going about this implementation work, have folks at the table and train ourselves to assess potential impact of any new modified program and investment strategy on our priority populations. Consider any unintended impacts, and most importantly, have them there at the table. Right? Don't talk about them, talk with them. So I want to close. Dana Blackwell from Casey Family Programs was not able to be with us today, but she wanted me to convey that Casey Family Programs has been and will continue to be committed to investing in strategies that will contribute to safely reducing the need for foster care. Hopefully, this learning series has been aligned with that purpose. Hopefully, we have given our jurisdiction partners the tools and resources that, when applied, will advance their capacity and ability to keep children safe, to keep families strong, and to build supportive communities. I certainly am proud of what we've created and our collective contribution to furthering the achievement of improved outcomes for children, families, tribes, and communities. I want to thank our partners at CDSS for always pushing the work forward. They've been, they experience the same resource constraints we all do. I want to thank our partners at Caltren for being folks, we are lucky to have them here in our state. They're one of the most professional training and technical assistance organizations that I've ever worked with. So really thank them for their seamless support of this learning series. And then most importantly, I want to thank you all for coming back month after month and for being willing to pivot and shift our orientation from 100 years of doing child welfare and probation a particular way to perhaps working ourselves out of a job at some point, truly. And we now have some resources and some strategies to do that. So with that, I'm going to close our formal presentation. I'm going to open it up for questions and discussions, and really just a deep gratitude for your listening for these last couple of years. All right, so let's go to our questions and discussion. Now that I've shown you, that's the part of the ride we're in. I'm going to stop sharing so we can see each other. We have one question that's in our Q&A box, and please feel free to put more questions in there, or just raise your hand and come off mute, and we can just have a conversation. But one of the questions I see here in the Q&A box is, it acknowledges that we work in a state where autonomy is so important. We are a state supervised, county administered system. There are 58 counties that end up, to some degree, doing their own thing. And Cheryl, I'd ask you here if there are any requirements or encouragements, we can add that to that there be collaboration on specific issues? And sort of where would you point to, right, when CDSS has made requirements and encouragements around collaboration?
I think that's present in the requirement, for example, in our 2083 work. That is memorialized in an MOU for collaboration across sector. And you think about partnering with other counties as well. And then just after the presentation on CalPrevents, there's an area there where you can collaborate, and maybe it will give rise to the need for affinity groups to come together and talk about a particular issue. But it is also an opportunity for us to consider moving forward other platforms to establish for that type of collaboration. But that was the intent behind establishing some type of core requirements for comprehensive prevention planning in your plans. And as a result of the presentation, you see the themes that emerged. And around those themes, I think we'll be able to build maybe listening sessions, learning collaboratives. I mean, there's a lot of opportunities that I think we would support and create going forward. But I certainly would encourage that as well at the county level. So, and we are aware, we will lift up where that collaboration is occurring in the state when it does happen, and when counties share with us that this is what we're doing over here. We would be happy to, have the state either lead a platform discussion around that and have other counties that, I mean, we're open to any suggestions around that piece. I do feel strongly that this is a season where I've seen counties not appear to be as autonomous, but more moving in the direction. I think we all have a shared goal to move in the same direction around prevention. So I think there's opportunities there to have strengthen the conversation. And to that extent, this team may end up supporting more of that. And they're, like I said, we're open to suggestions around that piece.
Great. And then we've got a question from Cindy Sutcliffe. Cindy, do you want to just bring some voice into it and come off mute and just ask the question so we can?
Well, I see the question, and she's basically saying that one of the reasons that counties are reserving their funds is to meet the match, and how will we do the reserving of those funds? And so that technical assistance conversation, Cindy, is something that we will develop with our fiscal partners in terms of how that happens. Our system's complicated in terms of how we preserve or reserve monies and what gets carried over and what doesn't. So the technicality of that would probably require some fiscal conversations with our fiscal teams and brainstorming with you in terms of how that happens. This is not the first time this has happened where we've had money and it goes away, or it's up for removal or a threat to be taken away. So we might need to reach back and figure out what some of those strategies have been in the past that have worked. And then thinking, as I mentioned earlier, and Kush has mentioned, you still have to think about what you do have and what you can use at the moment. So we've always say use it or lose it, but I also believe that there's some strategies that we can probably discuss together. I mean, you've been in the field long enough to know that there are constraints. And so we always try to figure out how to work within or without those constraints. So open to conversation more about that.
Thank you.
Any other questions? Anything about what we've heard? Anything you're curious about going forward? Not seeing anything else in the chat. Do we have some hands? Oh, there we go. Thank you, from Linda. So the question of periodic risk assessments, which I know is on folks' minds, particularly when we have questions about community pathways and contracting out services to community-based providers. It comes up then. Anything to share about what's coming, Cheryl, or any current conversations around that? I don't know if there is, but what are we thinking about?
Hi, Linda, thanks for lifting that up. I think the concept that you loaded in here around counties building that into their contracts with their CBOs, I think that makes sense to us. I mean, there's you have accountability, and once we sort of build our oversight to some of these elements, then we'll link to what you have put in place in your county and roll that up to what it looks like at the state in terms of how we oversight that. But we're not changing sort of that approach to periodic risk assessments, because you think about the natural need to do that is sort of built in the process itself right now. And the needs change, you go in and you update those assessments, right? And then a lot of it may be built into those checks and balances into whatever EBP that you have. So there's a variety of ways to sort of think through that, and there'll be more discussion about that too as well. So, but we certainly don't want to make it onerous. We want to be accountable at the same time, but it is something that also comes into play when you think about a shared responsibility. Even though child welfare owns the primary responsibility, it still is it could be a shared responsibility when we think about how we look at core practice and integrated core practice. So
Yeah, and just to piggyback on that, I know that, I've spent most of my life actually working on the back end of the system, where we've got needs, children with complex unmet needs, and systems of care wondering about, well, what do we do to serve them? I've worked in STRTPs and group homes where we've had to deal with community care licensing. And one of the things I've learned when it comes to items of consideration where risk and liability are primary concerns is, like you said, Cheryl, there's got to be an understanding that we are all working with communities that have been put at risk, right? And there are so to the degree that we can share the risk and we can make a commitment that when something bad happens, we're not going to throw each other under the bus. Those are the systems that tend to then be successful for the complex needs of the children and families that are in them. Because when we get really stuck on like, well, how am I going to cover myself, right, if something bad happens? Right? What if somebody's on a prevention plan and then child maltreatment happens, right? Mm-hmm. If we ask ourselves, how do I cover myself, right? That just leads to me versus you. If that's okay, we get this is going to happen, right? How are we going to together share the risk? Mm-hmm. I find those conversations end up actually coming to more favorable conclusions than the, well, I'm going to take care of myself and you're going to take care of yourself. I can't trust you to take care of my needs, and I can't trust you don't trust me to take care of yours. So just philosophically, I hope that that's a context that starts to infiltrate some of those conversations.
Definitely.
Other questions?
Yeah.
Another question, as spending plans change, should we send in modified expenditures to the state and wait for approval? Or can we move forward with using our allocations even if it wasn't in the first CPP plan?
You can move forward. We don't need to approve unless there's something that's really like controversial, not new. I think it's, out the box. You can run that by us, but no, the spend, we don't want to have that heavy hand of oversight. I think we've given you that guidance, and we want to encourage you to spend the money where you think it makes sense to spend.
Yeah, and I think I saw in CalPrevents, when Stephanie was actually sharing the resource hub, there was the CDSS resource on allowable activities for the state block grant. So it sounds like, Cheryl, as long as they're moving things around inside of their current allocation and it's all inside of that family of activities, you're okay with them doing that shifting inside of their allocation without having to come
because I
back to
mean,
you.
we know this is a fluid situation, so counties have to pivot where they can. So we're not being restrictive in that kind of oversight with the funding.
Yeah. Yeah, great. Okay.
No, I know there's a lot of doubt and unbelief around that because it's like, no, well, that's what they said until it comes to an audit or review. No, as she said, I mean, I think we've been really transparent about what we know and what we've committed to in our guidance about how to spend the money. And if there's anything contrary out there that we've messaged, then let me know. But I am here to say that, move forward with spending that money.
Right. All right. I am seeing no other questions in the chat. I'm going to share my screen for the last time as your moderator of this learning series. Turn it over to Jessica Matley and say, I'll see you on CalPrevents.
Great. We just want to say thank you all again for being here and having this discussion as part of the last forum of the learning series. A couple things to note. There will be a survey. We're going to drop right here into the chat. You can see it there. Completing that survey will take, it's very brief, but at the end, you'll receive a certificate of attendance. Also note that any recordings or resources discussed in today's session will be available in about the next 2 days and will be sent to your registration email. With that, we want to say thank you all for being here, and we'll see you again.